Hey guys, welcome to week 7 of the Healthy Happy Gut program. Today what we are discussing is actually poo, because our bowel movements can tell us a lot about our digestive health. So things like how it looks, whether it's formed or not formed, with the color of it, whether there's any mucus or blood. It all tells us a lot about what is actually going on in the gut. And it can be things such as hypoacidity, which is low stomach acid. It can tell us things like there's liver and gallbladder problems going on. It can also tell us whether there's potentially hormonal imbalances, especially associated with constipation. So it can tell us a lot of things. So today what we are discussing is poo. So let's first talk about the Bristol stool chart. So this is basically a poo chart, which shows us pictures of different types of stool and describes them slightly. So looking at the Bristol stool chart, you can check this out on Google, or I'll upload a picture as well. Ideally, we want to be aiming for a number 4 on the Bristol stool chart. So this is your gold standard poo. It's sausage-like in shape, it's smooth, there's not a lot of cracks or anything like that in, and it's easy to pass, and it's of normal color. So that's what we're aiming for. And if it's not that, more often than not, then we probably need to work on our gut health, okay? So I'll go through what each of the stools look like and what it can mean. So number 1 is looking like rabbit droppings, so tiny little pebbles. And basically that means you are constipated because it's a very slow transit time. Number 2 looks like a bunch of grapes. It can be sausage-like, but basically it's very, very lumpy. So it's very dry in nature. This also tells us that you have some constipation going on. Number 3 is kind of like our number 4, but it has a lot more cracks in it. So possibly dehydration and a bit of a slower transit time. So instead of going 1 to 3 times a day, you might be going just once a day or once every second day. Number 4 is the gold standard, like I talked about. Number 5 is basically soft blobs with clear-cut edges, and it tells us that you are lacking fiber. And it could also mean that there's some reactivity to foods going on as well. And then your number 6 is porridge-like, so it tells us that there is too fast of a transit time. So nutrients aren't being absorbed as well when it's going through very quickly. And number 7 is more watery and liquid-like. So basically too fast in transit, you're not absorbing nutrients from your food. So we really want to aim for that number 4, okay? So if it's anything other than that, we are working on your gut health to help improve it. How often should you be pooing? 1 to 3 times a day minimum. Probably if it's more than 3 times a day, it might be a bit much, especially if they're not formed. But if you're doing 1 to 3 times a day and it's number 4 on the Bristol stool chart, then you're going really well, okay? Let's talk about what can cause constipation. So something that we don't often consider, but we really should, is our emotional health. So things like the inability to let go of things or feeling stuck in certain situations can also have an impact on your bowels. So just like you feeling stuck, that affects your gut and it feels stuck too. Often constipation can be associated with trauma and depression too. It can also be a habitual thing, so you might have learnt to hold in your poos because of work or school, and thyroid problems can also contribute to constipation or slower transit time, as can food intolerances, lack of water and fiber, and also candida and other bacteria. What can cause diarrhea? So again, food sensitivities is a big one. Anxiety and stress. So our mental health, if we're feeling anxious and stressed and always on the go, it's probably likely we're more prone to diarrhea or loose bowel movements. And it can also be associated with emotional baggage that hasn't been processed or dealt with. A fast-paced lifestyle, like I said, also, and infections and parasites can also contribute to that. So what do the different colors mean? Ideally, we are aiming for a medium brown in color. Shouldn't be too dark and it shouldn't be too pale. So if your stools are green, for example, bright green poo indicates a quick passage through the bowel where the bile hasn't actually had time to change to brown. And it happens more so with the loose bowel movements, but yeah, green can be associated with bile insufficiency, so gallbladder problems. And also in babies, especially if they're having like green frothy poos, it usually means that there is a dairy intolerance too. Black poo, so that can contain blood from your digestive tract, but it could also be caused by things like iron tablets, licorice, and other medications. And when it's really dark in color, it does indicate you're more likely constipated. Red poo may be bleeding from your digestive tract, and yellow indicates liver or gallbladder insufficiency or dysfunction, pancreas dysfunction, and also potentially celiac disease too. So if you're having lots of yellow stools, we need to look into gluten sensitivity. We need to look at how your pancreas is functioning, as well as your gallbladder and your liver. Pale or clay-like, so this indicates liver function especially. Things like hepatitis, cirrhosis, gallstones, and bile dysfunction contribute to that more pale coloured stool. Yeah, so ideally we're aiming for that medium brown in colour. Okay, so if it's anything else, especially if it's more often than not, make sure you do tell your GP or your naturopath or whoever your healthcare practitioner is. So what can blood mean? Blood often means there's some damage in the digestive tract, and that can come from food sensitivities, allergies, or intolerances. It can also mean that there's other things that might be going on, whether there's cancer or hemorrhoids, or there's a lot of inflammation from things going on in your gut, okay? What does mucus mean? So mucus is usually shed, it can come from candida, so yeast infection, but it can also indicate that there's intestinal inflammation in the gut from food allergies and intolerances too. So a lot of babies will have a lot of mucus in their stools, and if that is the case, then I would be looking more at food allergies and intolerances. What can impact our bowel movements? Intolerances and food sensitivities, like I've mentioned, is one of the biggest things for irregular bowel movements. So this is why with this program we have you eliminate things like soy, dairy, and gluten, because gluten and dairy are two of the most common allergies and intolerances that are really not picked up on until you've removed it from your diet, and then you reintroduce it back in, and you can actually see the difference for yourself. And you can have intolerances without having a full-blown allergy. So if you've had an allergy test and been like, yeah, I'm okay, I can have gluten, but every time you eat a piece of bread, you're swelling up or getting indigestion from lots of pasta, then it's more likely you have an intolerance and not an allergy. So it's still best to really minimize the amount of that or avoid it. Our mental health also affects our bowel movements. Stress, anxiety, depression can all play a role in how our poo is formed and how frequently we go to the toilet. Parasites, candida, bacterial infections or overgrowths, and viral infections can also all contribute to irregular bowel movements. And then obviously our liver and bile function is really important, especially for that enzyme production. Even saliva. So if we're not salivating enough, we don't get those digestive enzymes coming out in our mouth from the start of our digestion, okay? The type of food we eat as well. So whether we're eating nutrient-dense foods or cardboard packaged foods, or like obviously we can have some of those foods too on occasion, but having more of those processed items over your nutrient-dense foods is also going to be impacting your stools, okay? Lack of fiber and water can also contribute to indifferences in your stool. And should it be smelly? Obviously it's not going to smell like roses, but if it's really smelly every time you go, it's not normal. Like, you shouldn't be stinking out a toilet where someone walks in and walks back out because it's too stinky. Okay, so if you are having offensive odor, it's more so an indication of bacterial overgrowth in the gut and fermentation happening, which is causing that excessive odor or offensive odor, okay? And it should only take a minute or two to do your poo. So if you're going to the toilet and sitting on there for half an hour, you're constipated or you are having difficulties pooing. It should be go in, do your poo, wipe easily. It shouldn't be sticky and take a million wipes to clean. And you should be able to walk out after a couple of minutes, okay? So if it's any more than that, then there is some bowel issues going on as well, okay? All right, so make sure you are taking notice of your stools more often and really take a good look at them just so that you have a better understanding of how your digestive health is functioning. And also make sure you're checking out your kids' stools as well. Like, obviously when they're older, it's a bit different, they can tell you. But if you have young kids, kids in nappies, kids that are still needing help wiping their butt, then have a look at their stool and see what's going on for them, because they may also need a bit of gut health support. All right, guys, that about sums it up about poo. Hope you have learned something new, and yeah, we are on our last 2 weeks of the 8-week Healthy Happy Gut program. So let us know how you're going and if you have any questions or concerns at all. All right, talk to you again next week. Bye.